much faster, at twice the rate. And in fact, if you just extrapolate those lines out, and again, that's the rather dangerous thing to do, they'll cross in about 3 to 4 weeks.
So it's like being in a parallel universe in terms of what you're hearing from Canberra and what you're telling me.
Well, it is, yes. I mean, there's quite a disconnect. And I suspect that a lot of the people who are making decisions probably don't understand the Doherty model that well. I mean, everybody's quoting it. But it's a really difficult document to go through. It's very complicated. I think I take my hat off to the Doherty people. It's a remarkably comprehensive document with a huge amount of information in it. But it needs some quite careful thought.
Alan, thank you. We might get you back.
Yeah, well, don't ask me. Oh, I'm not going to give you a prediction, so you can't come back and ask me, I told you so.
No, yes, I'm avoiding that. Professor Alan Saul.
Okay.
Thank you. Professor Alan Saul is a mathematical epidemiologist and honorary research fellow at the Burnett Research Institute in Melbourne. You're listening to Aaron's Health Report.
We keep hearing that the Delta strain of coronavirus is a game changer. Its increased infectiousness has meant it's muscled out earlier strains of the virus. It's now the dominant strain globally, and of course, it's the strain we're currently battling here in Australia. But how much of a difference does it make in people who are vaccinated? Researchers in the UK have been studying how well the Pfizer, AstraZeneca and Moderna vaccines protect against Delta and how likely people with so-called breakthrough infections, where a vaccinated person catches the virus, are to pass it on. One of these researchers is Sarah Walker, Professor of Medical Statistics and Epidemiology at the University of Oxford. Welcome, Sarah.
Good morning for me. Good afternoon for you.
So, Sarah, your study has found that people who got infected after 2 doses of vaccination, which is what we're told we should get, had similar levels of the virus in their body as people who were unvaccinated. So can you just remind us then of the point of being vaccinated?
So the really critical point is that although the vaccines don't work quite as well as they did against Alpha, 2 doses, particularly of Pfizer and AstraZeneca, are giving good protection against new infections. So the key point is, if you aren't infected in the first place, you can't pass it on. So these vaccines are still really reducing the number of infections. 2 doses is definitely better than 1. Just one caveat, we don't have enough people who've had 2 Moderna doses yet to look at Moderna in detail with 2 doses, but on a single dose, it looks just as great as the other 2 vaccines. So what is different is in the smaller number of people who do get infected. With Alpha, if you got it after vaccination, you had really low levels of virus, very few symptoms, and we just don't see that anymore. With Delta, if you get it, you have almost the same amount of virus in your nose and throat as someone who gets it despite not being vaccinated. And that's really critical. We weren't able to look at transmission directly in this study. And, there may be some reasons why you still might not pass it on quite as much, but fundamentally you've got the same amount of virus in your nose and throat, so you have at least the same potential to pass it on.
And
that's got
also
really big
symptoms?
Implications. Yeah, they certainly are. So so mild symptoms, we see at similar rates to unvaccinated people. However, we do not see the same rates of hospitalisations. So in the UK at the moment, we've got about 1% positivity in the general population, about the same as we had, September, October last year, but our hospitalisations are much, much, much lower. So the vaccine still stop people getting really seriously ill and dying. So even if you get it, you may get some symptoms, but you won't be as sick as you were. And that's really critical. Oh, and really importantly, even if you've had COVID before, you still do better with 2 vaccines. So The people who did best of all were people who'd had COVID and then got 2 doses of vaccination. So, it's a really strong reason for everybody to think seriously about getting vaccinated.
So you were going to say what the implications are for these really high viral loads.
Yeah, so I think the real challenge is that, certainly in the UK, people have talked a lot about herd immunity. And so this is the idea that actually you can protect society as a whole, including people who aren't vaccinated, by getting enough protection in enough people through vaccination. But the problem is, if people who are vaccinated still have plenty of virus when they get it and can still pass it on, which is what it now looks like, it means that unvaccinated people really can't ever be protected by vaccinated people, which is going to mean it's going to be very challenging to protect those people moving forward just from other people being protected themselves. And so I guess it really means that every individual person has got to think about doing the most that they feel they can in order to stop this
from really taking off. So
to stop it from causing more hospitalisations and deaths and really overwhelming the healthcare system.
So vaccines alone are not enough to control Delta?
So we don't know that yet. Remember, what we're actually trying to do is stop hospitalisations and deaths. That is actually the goal here. And obviously infections can lead to hospitalisations and deaths. But if we can break that link, we don't vaccinate against the common cold. The virus is almost certainly here to stay with us. And so it's about how do we move to a world in which we live with COVID and it doesn't, overwhelm the health system. So at the moment, we're doing well enough stopping hospitalisation and deaths. And it's just about keeping infections, at low enough levels so that we don't end up back in that terrible situation. I appreciate it's very different for you in Australia, but in the UK at least, that's where we are with it. And vaccines are an enormously fantastic tool in our arsenal to do that, because they just do still reduce infections. Even with Delta, we're seeing good protection against people getting infected in the first place. It's just that if they do, people need to know that they can still pass it on. And so they do need to take precautions within their household, outside their household. And certainly if you've got COVID, despite being vaccinated, you do need to isolate.
Very briefly, some countries are giving third doses, booster doses of the vaccine. Is this something that could overcome this?
So again, the goal is to stop hospitalisations and deaths. And actually, we have so few of those in our survey in the general population, we can't even look at that. We don't have any evidence that protection from new infections with AstraZeneca is changing over time. We found small changes, but too small to have statistical certainty. We did find that Pfizer was initially better by about 15%, but its protection did decline. So by 4 to 5 months, the vaccines look similar. And again, still giving really good protection, better than we might have hoped for.
So they level out
at about... they level out, yeah. So what I would say to people is there's no immediate cause for concern, but we've got to monitor it. And certainly what's going on in Israel would really support that.
Sarah, thanks so much for joining us.
Thank you.
Sarah Walker is Professor of Medical Statistics and Epidemiology at the University of Oxford.
Two very illuminating stories there on COVID for you. Parents are getting worried about what they're reading and hearing about the Delta variant in children. The increasing rates of infection are extraordinary, 10 to 15 times higher than last year in adolescents and younger children. Yet in Australia so far, the rate of childhood and adolescent hospitalisation is low at around 2%. But overseas, there are worrying stories emerging, especially from the southern United States, of a massive surge in Delta cases due to low rates of vaccination and mask wearing and a flow through to paediatric intensive care units, some of which are full. Ritu Banerjee is Associate Professor of Paediatric Infectious Diseases at Vanderbilt Children's Hospital in Nashville, Tennessee, one of the United States' leading